Module Overview. Introduction. The classification of drugs forms a fundamental cornerstone of pharmacology, enabling healthcare professionals to systematically understand, prescribe, and administer medications effectively. Classification is based on several criteria, including mechanism of action, chemical structure, therapeutic effect, and physiological target. Understanding drug classes is critical for predicting pharmacological actions, anticipating potential adverse effects, avoiding harmful interactions, facilitating rational drug selection. Drug classification systems. First, therapeutic classification based on the disease or condition a drug treats. Examples: antihypertensives, treat high blood pressure; antibiotics, treat bacterial infections; analgesics, relieve pain. 2. Pharmacological classification based on mechanism of action or target receptor. Examples: beta blockers, block beta adrenergic receptors; calcium channel blockers, inhibit calcium influx; ACE inhibitors block angiotensin converting enzyme. 3. Chemical classification based on chemical structure or backbone. Examples: penicillins, benzodiazepines, sulfonamides. 4. Legal classification regulates usage and prescribing rights. Examples: prescription-only medicines, POM, over-the-counter, OTC, controlled substances, Schedule I to V. Major drug classes and their mechanisms. First, analgesics, pain relievers. Non-opioid analgesics, e.g. paracetamol, NSAIDs, inhibit prostaglandin synthesis via COX enzymes. Opioid analgesics, e.g. morphine, fentanyl, bind to opioid receptors, mu, kappa, delta, in the CNS. 2. Antibiotics, antibacterials. Mechanism: inhibit cell wall synthesis, protein synthesis, or DNA replication. Examples: penicillins, cell wall inhibitors; tetracyclines, protein synthesis inhibitors; fluoroquinolones, DNA gyrase inhibitors. 3. Antihypertensives lower blood pressure via various mechanisms. Beta blockers reduce heart rate; ACE inhibitors block RAS system; diuretics reduce fluid volume; calcium channel blockers relax blood vessels. 4. Antidepressants elevate mood by increasing neurotransmitters. SSRIs inhibit serotonin reuptake, e.g. fluoxetine. TCAs block reuptake of serotonin and norepinephrine. MAOIs inhibit monoamine oxidase enzyme. 5. Antidiabetics regulate blood glucose levels. Insulin replaces endogenous insulin. Metformin decreases hepatic glucose production. Sulfonylureas stimulate insulin secretion. Anticoagulants/antiplatelets prevent blood clot formation. Heparin enhances antithrombin. 3. Warfarin inhibits vitamin K synthesis. Aspirin irreversibly inhibits COX enzyme in platelets. 7. Antipsychotics used for schizophrenia, bipolar disorder. Typical block D2 receptors. Atypical block D2 and 5-HT receptors. Fixed dose combinations, FDCs, combine 2 or more active drugs in a single dosage form. Examples: amoxicillin plus clavulanic acid, lisinopril plus hydrochlorothiazide. Benefits: convenience, improved compliance, synergistic action. Risks: dose inflexibility, increased side effects. Risks: interactions and contraindications by class. Each class has unique risks and potential interactions. Non-steroidal anti-inflammatory drugs plus anticoagulants equals increased bleeding risk. Angiotensin converting enzyme inhibitors plus potassium-sparing diuretics equals hyperkalemia. MAOIs plus tyramine-containing food equals hypertensive crisis. Opioids plus benzodiazepines equals respiratory depression. Clinical application of drug classes. Understanding drug classes enhances patient safety, efficient prescribing, clear communication among healthcare teams, tailored treatment plans for chronic or comorbid conditions, alignment with accreditation standards, This module adheres to CPD/CEU criteria for healthcare workers, International Federation of Pharmacists, FIP education standards, Pharmacy Council of Nigeria, PCN, guidelines, World Health Organization, WHO, Drug Classification Manual, UKNHS, Drug Formulary Guidelines. It ensures you can identify, explain, and apply pharmacological classifications in clinical, regulatory, and academic settings. Module 4 Summary. This module equips you with an in-depth classification system that organizes the world of pharmacology into practical, understandable, and clinically relevant categories. A firm understanding of drug classes empowers prescribers and healthcare teams to make informed, safe, and evidence-based decisions for patient care.